Hi everyone, welcome and thank you for joining us today. My name is Jane Hewitt and I'm the Capability Building Coordinator at Connecting Up and TechSoup New Zealand. Connecting Up and TechSoup New Zealand are part of the Info Exchange Group, a not-for-profit social enterprise that tackles the biggest social challenges through the smart and creative use of technology. And for those of you who haven't attended a webinar session with us before, Connecting Up and TechSoup facilitates an annual training calendar of webcoms, webinars, boot camps, and workshops to help the social sector upskill in all things digital. And you can check out our events program by going to either of the websites. So welcome to the webinar today, Remote Service Delivery, Learning from Adaptation During COVID-19, with Laura Breslin and Pamela Sadler from Mission Australia. And just before we begin, we'll start with a bit of housekeeping today. All lines are muted, so if you have any technical issues, please type them into the questions box on your GoToWebinar panel, and I should be able to assist you. If you have any questions during the session, please also type them into the questions box, and Laura and Pamela will answer them in the Q&A session at the end of this webinar. And please note that your comments and questions are not visible to the rest of the group. If you're on a Wi-Fi connection, please could you close any other programs that are running to get the best possible audio and video quality. Please note that this session is being recorded and we will send the slides and the recording to everybody at the end of today. And before we start, I'd also ask if everybody could take a couple of minutes at the end of the webinar to fill in a really short survey so we can help improve future webinars. That's all from me. I will pass over to Laura to get things started. Thank you.
Thank you, and hi everybody. So I'm Laura from Mission Australia. I'm part of the Service Design and Development team at Mission, and I've got Pam Sadler with me today, who's also from the Service Design and Development team. And we're going to talk to you a little bit about the work that we did during the height of COVID-19. And I know for some states they're still in that heightened state, but how we supported our service delivery teams in particular and our frontline community services to adapt during the physical distancing restrictions. Before I start, I just want to acknowledge the traditional owners of the land that we meet on here today, and I want to pay my respect to elders past and present and future, because they hold the memories, the culture and the dreams of the Aboriginal and Torres Strait Islander people. And I'd like to acknowledge that I'm on Darrell land, which is in southern Sydney. So for those of you who don't know, Mission Australia, we're a large non-government organisation and we run a range of community services nationally where we have services in most states. The breadth and depth of what we do is quite complex and varied. Our strategic goals are around supporting to end homelessness and also supporting communities and individuals to thrive. And we do that in various ways. So we are probably mostly known for our homelessness services and the work that we do in the housing and homelessness space. We also run a number of other services ranging from early intervention programs for families and children through to domestic violence, to mental health support, drug and alcohol services, and we also run some aged care services as well. So we have a really broad range of community services. I'm just going to talk a little bit about the Service Design and Development team and what we do. So we're a very small team. We're as part of what we call our national office functions. And we work really sort of at three different levels. So one of our key objectives is around really helping to understand the experience of the service users and the people that we serve. And what we really want to do in the way that we work is to create opportunities and capacity for service users' involvement in the design and the delivery of services. We also work to help our services build opportunities and we build capacity to strengthen communities. And we have a broad range of frameworks and tools that enable our services to support what we call our Strengthening Communities framework. One of the key things that we do is around service design. So we help our services to design solutions, services and programs. Now we are a small team, so we can't work with everyone. So we tend to work in two different ways. So we work on particular particular projects or particular services that are of strategic value or that are high impact, but we also take a capacity building approach. So we also look for opportunities to build the capacity of other parts of the organisation and our frontline staff to help them to use some of the tools and approaches that we use in service design. One of the critical principles that we work from is around believing that people with lived experience know their needs better than we do. And so we really look to harness the power of human-centered design in the way that we work. And I'm going to talk to you a little bit more this morning about human-centered design and how we use some of those methodologies and principles to create a response to the COVID-19 situation. So this is just a little bit about human-centered design and the key methodology that we work to as a team. Now, we generally use this approach to design new services or to design service improvements, but it can also be used to design strategies, products, policies, physical spaces, and a whole heap of other things. As well as being a set of methods and tools, it's critically a set of principles and a mindset. And what we do is we use these tools and mindsets and principles to do our work, but we also, as I said earlier, we also support our staff to embrace and use these tools within their work. I just want to run through some of the critical principles that we work to. So the first one is empathy. So we really seek to prioritise and understand the experience of our service users, and that can be the clients that are using our services. It can be broader than that. It can be the communities in which we work. And we hold their experience centred to the work that we do and constantly use that as a grounding point to ensure that, that we're in the right place, that if our services don't meet their needs or if the solutions don't meet their needs, then they're not essentially doing the right thing. We also work to look at problems before solutions. So we really take time and intentionally spend time in the problem space and use a number of tools and strategies to unpack and fully understand problems before we jump to solutions. And we find that can generally generate better approaches, and it can often lead to challenging some of our underlying assumptions and reaching a more creative options and more creative range of doing things. Collaboration is another key principle. So we absolutely don't have all the answers, and we're not a team of experts in the organisation. In fact, we actually facilitate discussions, and one of the key things that we seek to do is bring different sets of expertise and different experiences together so that we can really facilitate the generation of ideas. Another key principle is about failing fast and learning fast. So we really want to test our assumptions and ideas often, and we're really open to changing things and iterating our models and our approaches if they don't work. So we really want to learn and test things as we go. And the final principle that we work to is around desirable, feasible, and viable. Now, we understand that often the things that we want to do and are the best solutions may not always be the most financially viable or the most feasible option for our organisation. And obviously, you'll be aware, working within the non-for-profit space, we are restricted with resources and a number of other obligations. So we always look to balance out what is the most desirable option with also analysis around what's feasible and what's viable to meet the best option, the most sustainable option going forward. And critically, one of the things that we seek to do is co-design. Now, that could be co-designing with our staff. It could also be co-designing with people who've got lived experience. So I'm just going to spend a bit more time now talking about how we dove into the work around COVID-19. So rewind to sort of mid-March, and as you're aware, the world went upside down and Australia went upside down, and very, very quickly our services, who most of them deliver face-to-face services with clients, had to rapidly rethink what they were doing, particularly how they could embrace physical distancing restrictions. And most of our services reduce the amount of direct client support that they can do. So we were given, or we were asked to sort of jump in and help our services to think through that adaptation period. So obviously, as a large breadth of services, we have over 300 different service types within the organisation. As a small team of 5 people, it was very difficult for us to reach out and work with every different service and to help them to problem solve and to help them to work through how they were going to adapt their service delivery modes and their methods. So we needed to come up with an approach that could reach a number of people, but that was fast and that was quick, but that also enabled people to come together and share ideas, because we certainly didn't have the answers and we certainly didn't know enough about all of the services to be able to provide advice and support. So we needed to think of a way that we could facilitate services coming together to generate their own solutions. So we essentially developed 3 key strategies. So one was around sharing information, building awareness. We also looked to swap ideas and resources. So our work essentially sat within 3 key pillars. So the first pillar was about creating some resources and guidance sheets. So we quite quickly, and I'll talk a bit more about the methodologies that we used to do this, but we knew quite quickly that we needed to get some quite quick resources and guidance sheets out to services about very simple how-to guides, how they could start to use particular technology platforms, how they could start to think and plan about changing their modes of service delivery, and also sharing some tips and ideas that were coming up from other services. We also had a resource library, so there was a whole wealth of information being flowing around the organisation on email, lots of stuff outside the organisation as well, which was getting quite overwhelming. So we created a resource library on Microsoft Teams, and we curated the information so that it was accessible and easy to access and in one place for people in the organisation to access. Another key strategy that we're going to talk through in a bit more detail was around the facilitation of online forums. So this was really bringing people together across geographic boundaries and across different program types. And it had 2 key functions really. The first function was for services to be able to share and essentially come together and share what was their pain points, share their collective problems and really brainstorm and generate solutions together. The other key objective was for us to hear what the key pain points are coming up from service delivery, so that we could start to unblock and start to dive in and work on some of those key areas and prioritise some of the key challenges that services were experiencing during that time. We also used our Yammer channel in the organisation to share stories and to pose questions and to try and get some engagement across the organisation. So the work essentially took place over 3 key horizons, and we knew that we couldn't forward plan particularly because we knew that we needed to do things quickly. We couldn't really think, ahead of the next day. So we had to jump in and really just start doing the work and testing and iterating as we went, so that we really did lean on that principle that I spoke about earlier around failing fast and learning fast. We were trying new things all the time, and so we had to really sort of jump in and just give things a go. So the first horizon was really about meeting the immediate needs of our services and really trying to understand what their key issues were and really enabling them to continue to deliver their work within the physical distancing restrictions. The second horizon was, once we'd sort of met that immediate kind of let's just think about the here and now, there's some key issues emerged from that first horizon, and we were able to think about, well, how do we actually prioritise the issues that we're hearing and the concerns that we're hearing? And so we really wanted to take more of a risk lens over that second horizon and think about what were the key risk areas for our clients and how can we really support services to keep clients safe. And so there were 4 sort of focused themed areas that we worked on in the second horizon. And those were supporting clients with declining mental health, supporting tenancies at risk. So we're also a community housing provider, and so for our housing services, they were no longer able to physically visit properties, and so that was a key issue for them, was to help support tenants at risk without being able to physically visit properties. Another key area that we're going to talk through as a case study a bit later was about supporting vulnerable families and particularly protecting children who are at risk of harm during the pandemic. And the fourth area that we focused on was community engagement and development, because community engagement is so focused on face-to-face activities within the community that those services in particular really had to rethink the way that they operated. For each of those first two horizons, we produced a suite of guidance sheets, including case studies, good practice, and tips and resources. And we're going to show you a few of those that we produced that are available externally in a moment. The third horizon is essentially where we are now. So we have taken a bit of time over the last few weeks to take stock and to really pull out what have been the insights, what have been the things that we've learned during this experience. Now, we know some states, particularly in Victoria, and we have services in Victoria, are still experiencing the social distancing restrictions more acutely than other states. But it was a good time for us to pause and really think about what have been the great things that have happened during the last few months, and what are some of those good practices that we want to really keep going. We've also been thinking about, well, what are the challenges that services are still facing, and what are the new challenges that communities are facing through the pandemic. So we're in that third horizon now, and we're currently thinking about how do we prioritise and how do we start to instigate some work within the organisation to keep some of those innovations and good practices going long term that have emerged. I just want to spend a little bit of time talking about one of the key approaches that we used that was very successful during this time, and that was the virtual forum methodology. So as I mentioned earlier, we knew we needed obviously a virtual way to get people together to problem solve. We knew we needed to facilitate we needed to facilitate conversations, we needed to enable staff to come together and share ideas across different geographies. And so we developed a number of tools and resources to support virtual forums. And critically, we used a human-centered design framework, so drawing on some of those key principles that I mentioned earlier to really help understand and define the problems that people were facing and generate solutions quickly. So on this slide, you'll just see some of the tools that we used, and we wanted to ensure that clients were kept central to the conversation, so that we really didn't jump to solutions or jump to assumptions about what clients and communities needed, but that we grounded the conversation in let's just recap on who are our clients, what are their needs now, how have they changed, what are the objectives of the work that we do anyway, and how have those objectives changed, and what might some of the methods be that we now need to put in place now that we can't do some of those things face to face. So rather than jump to a whole heap of solutions, we sort of took people on a journey using those principles around empathy, so really trying to understand where clients were at now, what their experiences were during the pandemic, and starting to think about really understanding and unpacking those problems before we could start generating solutions. And we developed a consistent framework that we were then able to replicate multiple times for different forums. So it enabled us to work quickly and quite smartly so that we could generate a range of conversations across the organisation relatively quickly. One of the key tools that we used to facilitate this was a virtual whiteboard tool. Now, we dabbled in this before. Our services are national, so we often will run meetings via Microsoft Teams and other platforms, but we hadn't really done a lot of workshopping virtually, or we certainly hadn't finessed that work. So we had to, as a team, we really had to dive in and learn ourselves how to facilitate really good conversations and really good workshops virtually. And so we used Miro, which is a virtual whiteboard tool. And we had to, like I said, jump in and just give things a go. And quite quickly we learnt and were able to develop some visual tools. We were able to do some quick training quick training sessions so that people who we were working with could use Miro themselves, so people could jump on and use sticky notes. And what that really enabled us to do was collaboration. So again, one of the key principles of human-centered design is around bringing people together to collaborate. So we found that the virtual whiteboards really enabled that virtual collaboration and helped people to ground the conversation on the key topics, and using some of those visual tools really helped people to orientate themselves in the objectives. The other key objective around the virtual whiteboards was around really quick production of outputs. So we knew that we wanted to get things out to services very, very quickly. So by using the whiteboard tools and by getting ideas down really quickly, we were able to then essentially translate those into a set of resources, a set of tips, a set of guides that we could get out to staff very, very quickly within a day or so. We knew that getting things out quickly was very important during that time, because people were working very quickly to adapt. I'm going to hand over to Pam now, who's going to talk you through more of a practical case study about how we worked in a particular theme, which was around working with children at risk of harm.
Thanks, Laura. Yeah, as Laura mentioned, in Horizon 2, one of the 4 main areas that we identified that we wanted to explore more was working with families and children who are at risk of harm. Some of our services were identifying that they were facing some significant challenges, that they weren't able to visit families and interact with them face-to-face in the way that they had been, and they were concerned for the risks for children. So I worked on that stream of work, and the way we did that was in a similar way to the other the 4 other topics. We started with a pre-forum survey where we recruited people to participate in the forums who worked in the services and had some experience in working with vulnerable families. We got them to fill out a survey beforehand, which was really about identifying the biggest risks and the challenges for them in adapting their services, and that really helped us focus in on what they needed to talk about and the challenges that they wanted to problem solve together. We then had a first online forum which focused in on how can you identify the signs that a child might be at risk of harm when you're not able to visit them face-to-face in the same ways that we have been working with them previously. And then the second forum, we focused on, once you've identified the signs, how can we respond in the current context to those signs of risk? And then at the end of the process, we wanted to make sure that the resources and the ideas and the insights that we had gathered through working with the group that specialise in that area could be shared across the organisation, because we knew that a lot of other services were still working with children, and that this information would be very valuable right across the organisation. So I'd just like to show you some examples from the second online forum. Oh, there's one of the things that was really important in the process was we took the view that these services know how to do their work. They deliver best practice work with vulnerable families already. So what we wanted to unpack with them was, what would we normally have done in this situation, so that we could strip that back to the objectives of why we're doing it, and then look at alternative ways and think creatively about how might we still be able to achieve those things, but just in a different way that is possible within the current context. And it was very much a combination of sharing things that different services had been trying, and sharing ideas across the organisation, as Laura's mentioned, as well as collectively problem solving and trying to come up with some new solutions. So there was the second forum. The first forum we focused in on looking at what the different signs were and how we might see those in the current context. And then in the second forum, we picked an example of a scenario that was challenging for the services, so that we could unpack that in more detail. Laura, if you want to move on to the next slide for me. Thank you. The scenario that they wanted to focus in on was that they have concerns that a family is experiencing family violence. So this, I know, is very hard to read on the screen, but what you can see here is the kind of framework that we used to help them dive into this problem and come up with solutions. So as Laura keeps talking about, we really wanted to keep the family and the children and their needs at the very centre of all of the work we were doing. So that first column talks about the scenario. It talks about what this looks like, what the signs of risk would look like, what you'd visibly see and hear and notice that might be a red flag that this family could be experiencing family violence. And then in the bottom section there, we unpacked some of the things that we know about the family situation, and particularly in the current context, what they might be experiencing, a loss of control, heightened sense of isolation, and some of those kind of things, so that we could ground our solutions and ideas in the experience that the family would be going through. We then took a little bit of time to brainstorm what we would have done in that situation pre-COVID under normal circumstances, and things like putting a safety plan in place, and a whole lot of examples came up. And then we picked a couple of those to unpack and look at why we were doing them and what we were trying to achieve. So one of the ones that they really wanted to explore and felt was a really key strategy was getting access to mum. And engaging one-on-one with her so that they could provide support and do a whole lot of things with her. So you can see in the on the right-hand side of the slide, we've got a table where we unpacked a couple of scenarios. The first column says I would have done, but currently. And so the middle one there is the one that we unpack on the next slide, which was getting access to mum, engaging with her one-on-one. And they would normally have brought her down to the office or invited her to participate in a course or something like that that would get her to the office so that they could engage in a safe and honest conversation with mum. And as you can see in the middle column, we looked at the objectives behind that, and they said some of the things in engaging with her one-on-one would be about building awareness of the situation, of her rights, and that she has options, giving her emotional and psychological support, providing mum with contact info, phone numbers, other supports, looking out for small subtle cues, things that you might be missing, being able to assess her situation, privacy for her to engage honestly with us, opportunities to engage her with other supports, opportunities to refer her and give her information about where she can get other support, and making a safety plan. So once we'd unpacked that, we then took a moment, as you'll see on the next slide, to brainstorm around the solutions for that. Laura, if you want to move the slide on for me, please. So we just took a step back and we said, okay, how might we get access one-on-one to engage with mum in a safe way in the current situation? And we brainstormed together a whole lot of ideas that people had either been trying or creatively thinking about what else they could do to achieve some of those objectives. And they may not have been able to achieve them all at once in the same way, but how could we address some of those needs in different ways? So as you saw on the first slide with the 4 stages of this process, we then really wanted to make sure that we could get these insights and ideas and tips out to other parts of the organisation. So not only did we send these workshop boards that you see here straight back to the participants within a day or two, so that all the thinking and idea generating that they had done, they had accessible straight away and that they could start using. But on the next slide, Laura, thank you, you'll see that we produced a set of resources quite quickly that we could then distribute across the organisation more broadly. So in this particular stream, the ones that we produced were a little guide on basically adapting the service to work with children and young people at risk of harm in this context. So that had a section on what the signs are that you might be looking out for, how to see the signs, as well as ways of responding to the risk. And the second one, resource we produced there focused more on family violence and some of those ideas that came out of that second forum. And then another interesting example that came out of these workshops was a lot of services had started delivering things physically to families, care packs, information packs, dropping them off at the house, all different forms and all different ways, but it became clear that this was actually a really key strategy that our services were using for a range of different reasons. And particularly in this space, it provided an opportunity to get some safe face-to-face engagement so that you could check the welfare of the children, that you could see the way that people were engaging and pick up on some of the signs that you may have otherwise missed. So we produced a little one-page guide on that, looking at what the objectives of that might be, how you can make it effective, what were the things that were important to think about when you were doing it, ideas for improving it and building on it, and some ideas for what people had been including in the packs. So across both Horizon 1 and Horizon 2, as Laura mentioned, we did make sure that we were producing a range of templates and resources that could be disseminated widely across the organisation. And as Laura mentioned, some of them were shared externally as well on our external resource sharing hub, which you can see the link for up there. So in Horizon 1, this was some of the main resources we produced. One was a basic guide to remote service delivery and tips for how you might look at adapting your service. And as Laura said, that focused very much on the target group that you were working with, what their needs were, the objectives of your support, and then thinking through what the best tools and platforms and methods might be for adapting what you needed to do and how you could achieve those objectives in the current context. We produced a little guide on running virtual groups, just a range of tips for planning and facilitating virtual and online workshops and conversations. We also found that a lot of our services were really keen to use Facebook. And so we did some work around guidelines and what was good ways to do that and how to mitigate some of the risks that might be involved. And Laura will talk to that a little bit more in a second. And then we also produced a little sort of worksheet, which went alongside that first resource, the tips for remote service delivery. And it just provided a space where services could actually work through some of the questions and the framework for themselves, for their own service, listing out their own client target group, what the challenges were they were facing, and work through that themselves and end up with a plan for their remote service delivery. On the next slide, you'll see some of the examples of the resources we produced in Horizon 2. So as you saw before, the first three there are from the vulnerable families and working with children at risk of harm. And we also produced a guide on supporting communities remotely and some of the ideas that came out of the forums from the community development stream that we ran as well. And lastly, as Laura mentioned earlier as well, we did put together a resource library to try and curate some of the huge range of information and resources that were coming out at the time and make them available to our services in one place. Laura's going to have a chat about some of the challenges and how they were overcome now.
Thanks, Pam. So yeah, I just wanted to touch on some of the key challenges that we encountered. I'm sure that everyone's experienced, and I hope some of these things will resonate. And we'd love to hear from people on the line about some of the additional things that you might have experienced during this time as well, and how you overcome them. Some of the key things for us were obviously around the rapid adaptation that was needed to new ways of working. And so, as I mentioned earlier, one of the key principles that we worked to was just about having to give things a go. And so, you know, being open, particularly when we were online, using new tools. Look, we haven't used this before. If it doesn't go well, let's just be open to making mistakes. And so we really had to be sort of transparent and just jump in. You know, really learning webinar etiquette for us and how to create good practices and behaviours that supported online working. Doing little quick training sessions with different people and different parts of the organisation about how to use some of these tools and sharing some of the things that we'd learned along the way. Not knowing all the answers, and I think, as I've said earlier, that was one of the key principles that we worked with, was around that collaboration and bringing people together. So we had to spend a lot of time listening. We intentionally had lots and lots of one-on-one conversations, and we knew that we needed to create a space where people could just talk. And sometimes we found when we brought services together, they didn't necessarily want a lot of solutions. They didn't necessarily want resources, some did, but some just wanted that space to have a chat and connect together and just sort of offload and share what they were doing. And that space in itself was really valuable. Limited time and resource. Obviously, I'm sure you're all, would have felt the pinch as well during that time. Lots of, extra hours and frantic working whilst juggling children at home and everything else going on. But what we found was creating some consistent frameworks and consistent tools that we could replicate quickly was really key. So not reinventing the wheel. And working to 80%, not perfection. So getting things that we thought were good enough that we could just get out quickly, rather than working to get things perfect. Another key learning was around balancing risk and innovation, and I think this is one of the challenges that we felt quite strongly in the organisation. Was there were some amazing ideas and amazing innovation emerging in services in particular around this time, and we really wanted to support and enable that, but we had to overlay a risk lens. So Facebook, as Pam mentioned earlier, was a really good case in point around this. So we had services naturally wanting to jump and use social media platforms to engage with clients, but we didn't really have any organizational policies around this. It's not necessarily something that we would traditionally do. So our team, we found, had a key role in being that conduit between services so that we could raise awareness and gather the ideas and then work with other key parts of the organisation, like our IT department and our legal department, so that we could really unpack quite quickly what the key risks were and obligations, particularly thinking about client safety and protection of information, and also our contractual obligations, and how do we balance that risk with enabling services to use some of those tools in a safe way. And so that led us to, and particularly in terms of Facebook, we put some sort of temporary guidance in place that allowed services to use Facebook groups in a particular way, making sure we had the right permissions in place and we had the right guidelines in place for staff around sharing types of information. And that guide around Facebook is actually available on our external resource hub. Pam's just going to spend the last 5 minutes just talking about some of the learnings that we've heard, particularly some of the themes and patterns and good practices that we've seen in services that have emerged during this time. And then we'll spend the last few minutes opening the floor, and we'd love to hear from you about some of your experiences.
Thanks, Laura. As Laura mentioned earlier, we defined our third horizon as wanting to really understand and collect the learnings from this disruption, I guess, and make sure that we were holding on to what worked well and looking at how to embed that in our practice going forward. So we've been collecting learnings along the way as we go. And we have currently spent a bit of time taking stock and trying to collate those learnings, and we're looking at how to hold on to some of those things, what's worth embedding, and are there pieces of work that we as an organisation need to do to provide the foundation to make sure that services are supported and equipped and enabled to do that in a way that is best practice as well as balancing risk. So some of the learnings and insights that we've collected, you can see here, we found that new ways of engaging via digital delivery really opened up different modes of communication and engagement for some of our clients. And some of our clients really benefited from more individually tailored approaches, from greater choice, and some really benefited from increased frequency of contact or a mix of different communication methods where we may not have used those in the same way in the past. We found for some of our clients that they experienced more coordinated care, particularly when it came to working with different agencies and different providers. Some of the digital technology really helped providers to more easily collaborate. For example, it was easier for some of our services, they reported, to sit in on telehealth appointments or things like that than may have been possible when some of this was face-to-face. Some of our clients really experienced empowerment through digital literacy. It was intense support that was sometimes needed to really build their digital literacy rapidly or get them access to technology and overcome a lot of the barriers that they were facing. But staff reported that for some clients that paid off hugely in seeing the independence that they were able to gain, or the things that they were able to do that they hadn't been able to do previously. However, we have certainly noted that for some groups and for some clients, they've been left behind in this as the digital divide has become bigger, especially for those facing barriers to accessing digital platforms, those who have low literacy levels with a lot of the things going online and in a more written form. There are definitely people who we need to make sure that we don't leave behind in this phase. We also saw more broadly, we saw in the homelessness sector some really intensive collaboration, and we saw some unprecedented numbers of rough sleepers moved into temporary accommodation and engaged with wraparound supports. We also saw fast-tracked housing outcomes come out of focused collaboration and partnerships that were really strengthened and built on to move people into permanent housing. We did see for some of our services that there were changes to the way people accessed support. So some entry pathways, particularly soft entry pathways or events or things like that, obviously were no longer available and more difficult. But other ways of accessing support opened up. So that is an area for more exploration as well. And as I'm sure many of you have noted, many clients experienced increased social isolation and declining mental health, and that's an ongoing challenge that our services are looking at how they can support clients to address. So we are really keen to hear other people's insights and learnings, and also the challenges and opportunities that you guys encountered during that really intense period of adaptation. So we'll hand over for our Q&A.
Hi, we don't have any questions at the moment. Did you have a couple that had come in before?
Did we have questions?
Yeah, I think you might have had some questions that you wanted to, or just some like FAQs or something.
We've got a couple of questions here that we'd like to ask. If anyone, yeah, we'd like to ask a couple of questions if anybody would like to respond. So the key questions we've got here are, more broadly, what resonated, but what were your challenges of adaptation during COVID-19? And what challenges or opportunities did you encounter? We'd really be interested to hear from other organisations. I'm sure there are some similarities but some differences in terms of the experience. One of the key things that we're thinking about now, and we certainly don't have the answers, is about how do we sustain some of the good practice and the innovation that's emerged during this time. So I'll be very interested to hear any thoughts or comments in that space.
We've got one from Marianne saying, I've done some reading about how we may have been working swiftly and purposefully at the start of the pandemic situation, but that this motivation may have faded as the uncertain situation continued. How have you ensured that staff have continued to be interested and engaged after the intense period of adaptation?
That's a really good question, and I think we're at that point now. I think we're really sort of facing that challenge and working through that. As I said, in that third horizon, we certainly experienced that there was that sense of urgency around having to do things different. And what we're trying to kind of grapple with now is how do we make sure that we don't slip back to the way things were before, because we know there's been some great stuff that's emerged, but how do we bed that in good practice? So some of the key things that we're thinking about is just sharing case studies and making sure that you know, sharing stories and things and keeping that conversation going in the organisation is really important. And also doing some further, for us as a team, doing some further research and analysis in terms of understanding that good practice, and thinking about what some of the organisational policies and procedures might need to be that need to change to embed things like digital delivery ongoing. Is there any staff training that we need to embed through across the organisation to help them to sustain some of those changes? But very open to other ideas, because it's certainly a challenge that we're facing. We don't have all the answers.
Okay, thank you. Does anybody else have any questions they'd like to type in? We've still got a few minutes. Just while we're waiting for that, when I send out the recordings, is it okay to include your email addresses so that people can get in touch if they want to discuss anything? Or
yeah, that's fine. Yep. Absolutely.
Great. Okay. Everybody's been very quiet. Okay, well, I will draw this to a close then, I think. Thank you both very much for joining us today, and thank you everybody for coming along and having a listen. And as I said before, we will be sending out the recording and the slides to everybody at the end of today when they've been uploaded onto the website. And if people could take a couple of minutes to fill in the survey that will pop up at the end of the webinar, that would be really appreciated. So thank you, Laura and Pamela, for joining us, and hope to see you again very soon. Thank you.
Thank you.